Hi, I'm Tim Oram, Director of Legislative Services at the Hospital and Health System Association of Pennsylvania. 2011 will be a defining year for healthcare in Pennsylvania. Our new governor, Tom Corbett, and the legislature will make decisions this year that will define the care that Pennsylvanians receive or don't receive, as well as define the future for healthcare in our state. As you may know, Pennsylvania faces an estimated $4 billion budget shortfall. Because the governor and legislative leaders promised that there would be no new taxes, a series of sweeping spending cuts are likely. It's where those cuts are made that will define the care that Pennsylvanians receive. With nearly 21% of the state's total budget spent on our medical assistance program, which provides basic health care to more than 2 million Pennsylvanians, the hospital and healthcare community is very concerned that funding for this critical safety net program may be cut. Even a small cut to the medical assistance program would have devastating impacts because the cost of the program would be shifted to hospitals, employers, and others. Hospitals would be forced to shut down important services or programs they could no longer afford to offer. Employers and individuals with other types of health insurance would have to pay higher insurance premiums. But that's not all. Another big concern is Pennsylvania's legal climate. It's one of the worst in the nation, with Pennsylvania doctors and hospitals having to pay some of the highest medical liability costs anywhere. By implementing several common sense reforms that are already enacted in other states, Pennsylvania would lower its costs and increase the number of physicians that want to practice in our state. Governor Corbett and Republican lawmakers agree. They have already pledged to make medical liability reforms one of their top priorities, which are ensure that defendants are responsible for their fair share of damages in a case, ensure that healthcare providers can apologize and offer expressions of grief without the words being used against them in court, and ensure that healthcare professionals are protected from baseless claims. These items would help to reduce medical costs, increase the number of physicians that want to practice in our state, and define Pennsylvania as a state serious about its residents and their health care. In the next few weeks, we'll ask you to contact your lawmakers about these critical issues. Your voice will help to define the care that Pennsylvanians receive, as well as define the future of health care in our state. CareforPA will notify you when your advocacy help is needed. I hope you will join me in reaching out to state lawmakers at that time to let them know how important it is to support Pennsylvania hospitals and the critical services and care you provide.